Anyone who is feeling under the weather for whatever reason knows that being sick is no fun. But when you have diabetes, you need to be especially careful when you are sick because illness has a direct impact on your blood glucose level.
Illnesses will increase your glucose level. If you get a cold, if you get an infection or ear infection, you get any kind of infection, you get a cut on your hand and it get infection, your glucose levels will go up.
When your body is under stress, as it is when you have an illness like a cold, sinus condition, or the flu, an infection like a urinary tract infection, yeast infection, ear infection or eye infection, an injury such as having a broken bone, a foot ulcer, or are recovering from surgery, or even sometimes during difficult emotional times, hormones are released to help your body handle the stress. These hormones often cause symptoms that signal they are fighting the stressor, such as a rise in your temperature. Another common result of these hormones is a rise in blood glucose, sometimes to extremely high and dangerous levels. It is also possible for your body to be fighting an infection without having any obvious symptoms. If you notice your blood glucose is high and there is no other reason for the change, you may be fighting an illness or infection. With or without symptoms, high blood glucose will make it harder for your body to fight the illness. If you don't take action, your illness will probably get worse, which can raise your blood glucose even more. If this damaging cycle of illness and high blood glucose is not controlled, you can end up in the emergency room or even in the intensive care unit of the hospital. Take action against your illness, infection, or injury by checking your temperature regularly, staying warm, getting plenty of rest, and drinking lots of fluids.
Especially when you're ill, you may not feel like getting up and making food for yourself or taking your medication.
Because you may not feel like doing anything other than resting while you are sick, take the time to set up a sick day plan ahead of time.
But we like to plan ahead so that when you're ill, you'll know exactly what to do.
Your plan will guide you through this period, helping you maintain the delicate balance between taking care of your illness and managing your diabetes. Your sick day plan will be individualized for you.
One of the first things that we do want to make sure that you do is to have your blood sugar checked more frequently than probably you're used to doing.
More than 2 times a day?
Yes, at least 4 times a day.
Your sick day plan will tell you how often to check your blood glucose, what medications to take, what you can eat and drink, when to call your diabetes care team, and if you should check your urine for ketones. Ketones are made when your body breaks down fat for energy instead of using glucose. High blood glucose together with a high level of ketones means your body is not making enough insulin to properly move the glucose out of your bloodstream and into your cells for energy. This can lead to ketoacidosis, which, if left uncontrolled, can lead to coma or death. So you may be told to check your urine for ketones every 4 to 6 hours, or when your blood glucose is higher than 240 milligrams per deciliter. The symptoms of ketoacidosis include stomach pain, confusion, trouble breathing or heavy breathing, dry mouth, or fruity breath. You may have other symptoms of ketoacidosis, so talk to your diabetes care team about what to watch for. If you are at risk for ketoacidosis and experience any of these symptoms with high levels of ketones in your urine, call your diabetes care team right away. If you take medications to control your blood glucose, including insulin, continue to take your medications even if you can't eat as you normally do. You may think you don't need as much medication, but you do because your body is under stress. And remember, when it's stressed, your body makes extra glucose and has trouble using insulin. So your diabetes care team may recommend that you take more medication than usual. Insulin may become part of your sick day plan to help your body use the glucose for energy, keeping your blood glucose in a healthy range and helping you feel better faster.
A lot of the medications like NyQuil and some of those things, they have a tremendous amount of sugar in them.
Check ahead of time with your doctor or pharmacist about which over-the-counter remedies for symptoms such as congestion or diarrhea do not contain sugar or alcohol. Have these medications on hand before you get sick, and every now and then check to see they have not expired. What you eat and drink when your body is under stress is important to your healing and recovery. If you can stick to your normal meal plan, that's best. In addition, drink calorie-free liquids like water and diet soda to keep from becoming dehydrated. But a lot of times when you're sick, you're not able to eat as you normally would. Work with your diabetes care team to develop a sick day menu and keep these foods on hand. When you are too sick to stick to your regular meal plan, consult your sick day menu. Remember, your body still needs nutrients, so try to take in your normal number of carbohydrates by eating foods like gelatin, crackers, soup, or applesauce. If even these mild foods are too hard to eat, you may have to stick to drinking liquids. Regular sodas, juice, sports drinks, popsicles, or sherbet will help give you the necessary carbohydrates. And finally, your sick day plan will tell you when to call your diabetes care team. You may need to call your care team if your blood glucose results are higher than 300 milligrams per deciliter for 2 readings in a row. You have a fever of 101 degrees or higher. You are unable to drink fluids or keep fluids down for at least 4 hours. Your symptoms include vomiting or diarrhea. Or you have symptoms of dehydration or ketoacidosis, including stomach pain, confusion, trouble breathing, dry mouth, or fruity breath.
Okay, that's what I'll do. I'll call you in the morning.
Being prepared for an illness means you should have certain supplies on hand to help you cope. These include a list of telephone numbers, a notebook, a thermometer, extra medication, prescription and over-the-counter, a blood glucose monitor with extra test strips, if needed, keto sticks to check your urine for ketones, sick day menus and the foods that are suggested in them, and a written copy of your sick day plan. Your list of phone numbers should include all members of your diabetes care team, including your doctor, diabetes educator, registered dietitian, and pharmacist. And don't forget your contact person, a family member, friend, or neighbor who can check in on you from time to time.
I would like for you to call me in about 2 hours, check on me.
All these numbers should be posted by your telephone.
Yes, it's me.
It is helpful to keep close track of your illness in a notebook. Keep track of your medications, what, when, and how much you're taking, your temperature, what, when, and how much you're eating, and whether you're able to eat solid foods, and any symptoms you may be having. All of this information can help you and your diabetes care team decide the best way to fight your illness. Keep a written copy of your sick day plan and supplies together in one place so you know where to find them when you aren't feeling well. Creating a sick day plan before you get sick makes it easier for you to control your diabetes, while at the same time giving your body a chance to rest and recover. So on the days when you are sick, you can focus on what's important: feeling better.